Hi, I'm Dr. Roadhouse, and want to introduce you to our patient, Julie. She's in our thyroid recovery program, and we already did your first video after about a month, and so you've been progressing. And just wanted you to kind of go over the symptoms that you had, your journey, some of the other doctors that you went to, and everything, and then how you're doing since coming in here.
Okay. I started about 2 years ago with severe fatigue and hormone difficulties, sleeping difficulties, anxiety, weight gain, a lot of weight gain, about 25 pounds. And had
Which is unusual for you,
Which
right?
was unusual for me because, I've been very fit and fairly thin.
And you weren't doing anything that could have, you didn't change a whole lot, so all of a sudden...
No, I was exercising.
Right,
I was actually exercising more. I was eating clean. I was eating better. And I still tended to gain the weight, but not feel very well. I went to one naturopathic doctor that helped me a little bit. Finally, he would at least diagnose the Hashimoto's and help me a little bit. But I started feeling a little better on some thyroid medicine, but only for a few months. I kept trying for about a year, working with him, and I just never, felt much better. And he also mentioned the adrenal fatigue syndrome, and I found a different doctor that specialized in that. And so I worked with him for a while, and I felt a little bit better, but again, just for a few months, and then I went back. Another patient that comes here had told me about you, and I had remembered her telling me, and so I looked this office up again, started coming here, and that was in
December, wasn't it?
I think it was more like October
okay,
of last year. And so so it's been that many months since October of last year. And so many of my symptoms went away. Number one, I immediately started feeling, just within a couple of months, started feeling more energetic. I started, my hot flashes had gone away. My menstrual cycle had gotten normal again.
Which it wasn't.
It wasn't normal. Yeah, I thought I was in menopause, but evidently I wasn't. It came back and I'm a lot more normal. The sleeping difficulties changed very quickly, just within a couple of months. I started sleeping like a normal person through the night.
And what was it like before that?
Oh my gosh, before it was miserable. I couldn't go to sleep to begin with. And I'd have to keep getting up and down, because I kept waking my husband up. So I'd finally think I was sleeping enough to lay down and go to sleep, and I couldn't sleep. If I did fall asleep, I'd wake back up. Horrible hot flashes, where I felt like I needed to even bathe before I could lay back down. And it was just up and down all night long. This went on had really gone on for years, that part. But so the sleeping right there was such a big, that's probably why I started feeling better pretty quick, as soon as I started sleeping better.
Sleeping is important, especially when you can't sleep,
Exactly, it was miserable. Sometimes I would be in tears when it would be close to bedtime thinking, I got to go through this because it was so miserable. But so that got much better. And so I was on the program for about 4 months probably before I actually started losing weight. I just started losing the weight in January, so that's just been 3 months ago, and I've lost 17 or 18 pounds. I haven't changed anything.
It's just everything's starting to work. And I remember we told you this isn't a weight loss program.
Right, it wasn't because of that. But
we're trying to get you healthy and make sure that we get everything working right. And if we get everything working right, then the bonus is you're going to lose the weight.
Right.
So we're doing real good. The anxiety's been a lot better.
Anxiety's been a lot better, and if something happens that, I still do deal with that anxiety if something big happens, but it's not on a daily basis, 24 hours a day.
Well, and now, I think before you were dealing with anxiety all the time.
It was all the time.
And now it has to be something pretty dramatic, to get you kicked in and doing that. Otherwise, you've been doing pretty good, huh?
Yes, as long as I stay away from the gluten and the things that I've,
And that's one thing that you might want to talk about, because some of the tests, like adrenal test and some other stuff, but the intestinal stuff, the testing that we did, and all the Cyrex testing, that was really what was able to us pinpoint exactly what your problem was and get you away from it, because it's confusing and you don't know exactly what it is, and so since then we know exactly what your triggers are, especially with Hashimoto's. It's even more important with Hashimoto's, and it wasn't just gluten. And that's what everyone thinks, well, gluten is a big part of it, but there's
Mhm.
more to it than that. And if you just remove the gluten and don't do the other things like what we found on your test, that's why you don't get the results.
Right,
you know?
right. Well, the testing, yeah, it was the key to a lot of it, because even with the first naturopathic doctor, he did some testing and told me that I had the Hashimoto's, and I had already pre-read about gluten sensitivity and allergies, and even specifically asked him, so it's not gluten, and he said, no, that's not what your blood test shows. So
Yeah.
whatever it was that
Yeah.
he was doing,
Yeah.
it did not reveal that.
Yeah. And that's why we use Cyrex, because you produce it's the best test in the world, developed by Dr. Vajani, who is a top immunologist, a scientist with a PhD that studies the immune system. And so that's why we use those tests, and that's why we figured out what was going on with you. Good. So otherwise, doing
helpful.
good, energetically, doing good. Husband's happy,
Yep.
right? Yeah,
Much happier
everyone's
than I'm
happier.
happier.
Good. Okay,
Yeah.
good. Anything else?
Just the energy, just having the energy. I've not had one of those days where I've been on the couch the whole day.
Yeah.
And that
And
was
that
happening several days a week. On some days, if I wasn't having to be out, then I didn't feel like doing anything. I just, I laid on the couch.
And
I've not
now
had
you've
any of
been-
those days for months.
Nice.
So
Yeah,
that's
sometimes
really
good.
nice.
Well, it sounds like you're well on your way. We still got a couple more things. We're going to be working on the estrogen dominance, and then we'll check in and see how you're doing then. Okay, I'm
Okay.
glad you're doing great, and I'm glad you came in. And make sure to thank that lady that referred you. And
Yes, Karen.